Hi, welcome to part 3 of chapter 23, where we are continuing on our discussion about the menstrual cycle. So far, we've talked about the parts of ovulation. Ovulation as the follicle-stimulating hormone and the luteinizing hormone, which come from the anterior pituitary, will affect the ovary. The as the follicle-stimulating hormone stimulates the follicle to grow, it will result in the follicle secreting estrogen. This peak in estrogen then goes back and causes luteinizing hormone to surge. The surge results in ovulation. Then, after ovulation, the corpus luteum, which is left, will affect the progesterone. Now, let's look at a little more detail in terms of the estrogen and the progesterone and how that has an effect on the menstrual phase. If the endometrium, the estrogen and the progesterone will cause thickening of the endometrium. The endometrium is the inner lining of the uterus. The gland and the blood vessels increase in size. The estrogen and the progesterone shut down the follicle stimulating hormone and luteinizing hormone by negative feedback. If the ovum is not fertilized, the corpus luteum degenerates, the estrogen and progesterone decrease. And that decrease will cause the uterine lining to decrease and be sloughed off, causing menstruation. Okay? Now, menstruation occurs every 28 days, and please pay attention to which hormones are produced by your pituitary, which ones are produced by the ovary and through the corpus luteum. Now, it doesn't talk about this one, but if there is pregnancy occurring, the pregnancy the developing embryo will produce HCG, human chorionic gonadotropin, that's the pregnancy hormone detected in the pregnancy test. It will feed back and keep progesterone and estrogen being produced. As a result, increased rates of estrogen and progesterone. If we look here, if we keep estrogen and progesterone high, you keep your uterine lining high, and you prevent the a new follicle from being stimulated and a new ovum being released. So that's a way to prevent a further egg to be released. Now, with age, the menstruation will cease. The normal ovarian functions decline. You stop the ripening of the follicle, no estrogen. Estrogen decreases and everything starts to atrophy and shuts down. We'll get it, wait till you hit that lovely stage. Okay, when you look at birth control, mainly birth control will, there's hormonal methods. With the hormonal method, what most hormonal methods are is they contain a form of estrogen. Realize that estrogen is a group of chemicals. So if you look at birth control pills, you may see something called estradiol or estrol. These are a group. So most hormonal birth control methods control estrogens or progesterone, which negatively feeds back on the anterior pituitary, decreases luteinizing hormone and follicle stimulating hormone. No egg is released. Male contraceptive pill is still under investigation. The reason why is it doesn't really cycle sperm. Billions of sperm are released every day or every 72 hours, where in females, 1 egg a month. It's a little easier to cure. The morning after pill. The morning after pill is an estrogen and progesterone blocker. So the whole idea, it's used in emergency contraception because if you block the estrogen and the progesterone, what it does is it will decrease the estrogen levels. When you decrease those estrogen levels, that results in menstruation. Notice the spelling of menstruation. There's a stru in there. Most people just call it menstruation. It's menstruation. Okay? In terms of infertility, all sorts of issues with female problems. Female problems are often related to, just a second, I got it. Problems with infertility, menstrual disturbances, tumors, and infections. All sorts of stuff going on there. Notice when you have you have menor. Amenorrhea means no menstruation. Dis means painful. And then there's premenstrual syndrome. Premenstrual syndrome is not, they're trying to prove it, but they can't because it doesn't happen in every woman. Only every woman I know. Endometriosis is another situation where the endometrium gets into other parts of the body. Infertility, big problem due to infections, disorders, pathological. The problem with infertility now is a lot of women are waiting till they're older, till their 30s, and then they decide to get pregnant, and by then it's too late. Things aren't working right. Plus, you may have been on birth control for years, so it's hard to re-regulate your birth or your hormones. Some women, however, have no difficulty getting pregnant. That's a whole other story. Okay, when you're looking at vocabulary, realize that semo is sort of a seed word, seminal vesicles. That usually has to do with sperm. When you have a fur, you carry it. Crypto is the undescended testes. Testicle words are orchard, like an orchid. Female words are ova. Meno has to do with menstruation. Notice that middle syllable, menstruation. Mast is breast, and salpingo is the uterine tube. It has to do with trombone or trumpet, one or the other. Salpingo oophorectomy is a cool word. That means you're cutting out your fallopian tubes. And that was a very brief discussion. Look at that happy woman. You can tell she's infertile, so she has to garden. Please pay attention to these videos. The ovarian cycle, it blocks it out nicely. And in vitro fertilization, just a little bit about what's going on there. It's very controversial because you're bringing in children who aren't created in a natural circumstance. The life of the sperm, ovulation is very important. And that's it for this last unit.